Good morning, good afternoon, everyone. This is your girl, Cassandra Taylor from Top Flight Defense Incorporated, nonprofit organization created by women veterans for who? All women. But today we are talking about our women veterans, and we are on the line with Asya and Angela from the Jesse Brown Women's Health Program. So we are here so that we can talk about all of the programs that are offered at Jesse Brown. And if you don't have a VA to go to women's clinic, come on over to Jesse Brown. So without further ado, either Angela or Asia, you can get started.
Sure. Thank you so much. We're really honored to be here and share information about women's health services and what we offer our women at the Jesse Brown Healthcare System. We are really proud of what we do, and we thank women veterans for listening, and we encourage you to utilize our services. And if you have women veterans that you know that are not utilizing our services, to share the services that we have available and that we do have them. The first thing I will say is that we have a robust women's health program. It's made up of the Women's Health Medical Director, the Women Veterans Program Manager, and a Women's Health Program Specialist. Dr. Sharda Deshpande is our Women's Health Medical Director. I am the Program Manager, and Angela St.Paul is our Program Specialist. Every VA in the country has a women's health program, and they have a Women's Health Medical Director and Program Manager at each facility as well. So for women who are not connected and don't know that there are services available, please know that they are, and they are designated women's health providers at each site, not just the main campus of a facility, but also within the C-box. That is a mandate to make sure that women veterans are served. That's sort of a very quick overview. I will let Angela share more about our clinic, the kind of services that we offer within the clinic, the providers within our clinic, and also what we have across our C-box.
Thank you, Asya. Hi, everyone. Thank you. So just to let everyone know, the services that are offered at the Women's Health Clinic at Jesse Brown, we have primary care services, gynecology, urogynecology, conceptive care, maternity care services. We do mammography coordination, ultrasound coordination. We do cervical cancer screenings, mental health care and counseling that's available, as well as psychiatric services. And then we do also have social work services that are offered, peer support and transgender care, as well as eating disorder services and women's addiction services. One of the things that's good to know with the staff for these, that it kind of, is broken down where we have so many at each, at Jesse Brown. So for an example, we have 2 part-time gynecologists that are in clinic. We have one full-time provider that's a urogynecologist. We have 2 full-time MDs that is in clinic. And then we also have nurse practitioners that are available in clinic as well. And then below that, we do have RNs for the gyne team and PAC team. And then we also have LPNs. And then we have our MSAs for the front desk to help with the needs of scheduling and rescheduling or cancellations of appointments.
One thing I'll add to what Angela is saying is we're very proud of the fact that we have a standalone women's clinic at the Jesse Brown facility. So outside of the primary care clinics, which are on the first floor of our Damon building, our Jesse Brown Women's Program is located on the second floor of the Ogden building. And that's intentional so that we can maintain the privacy and dignity of our women veterans so they have an individualized space where they can go. We are always looking to make our facility more welcoming and friendly to address harassment that unfortunately takes place with women and also sometimes with men, and sort of be very outspoken about always wanting to make our services better.
And I do want to say, yes, we have our main campus, the Jesse Brown facility, but women's health program is actually a lot more bigger than just at Jesse Brown. We have 4 community-based outpatient clinics that women's health is actually at. So you could be seen at the Women's Health Clinic in Lakeside CBOC, the Auburn Gresham CBOC, Chicago Heights, and Crown Point. And at each one of those facilities, we have a minimum of 2 designated women health providers. So if you are more closer to one of those, out in Crown Point, ABJ, or Chicago Heights, Auburn, Gresham, Lakeside, you could definitely get care at those facilities as well.
Jesse Brown is very proud to have the largest number of women veterans in the entire VISN and entire region. So VISN 12, we have the largest women's health clinic in the facility. And we've also been able to grow our program significantly with a grant that we were approved for 4 years ago called WISE, Women's Health Innovations and Staffing Enhancements. So as a result of that grant, we've been able to develop some of the programming that some of the services that Angela mentioned. We have an eating disorder program within Jesse Brown. It serves men and women, but part of the Jesse Brown, part of the services available to women at our facility. We have a specialized eating disorder program for women so that women feel like they can receive care and not fall through the cracks where they feel like they don't want to be in male-dominated spaces. We've been able to increase our coordination. So we have maternity coordination, cervical cancer coordination, mammography coordination. We were able to increase that with WISE. We have a peer, like Angela said, in the clinic, co-located, who is aware of the services we have when it comes to mental health, social work, be able to link up with women veterans who may want to connect to someone who has literally been boots on the ground and has walked the walk. And we're really proud of that. We've also extended our pharmacy services this year. So we have a full-time pharmacist, women's health pharmacist within our clinic. And we're very proud of that. We appreciate being a one-stop shop and offering the services that we do.
I do want to mention as well something that's actually going to be coming to Jesse Brown, because you're talking about the growth of the program from where it started. We are actually at Jesse Brown having a mammography suite that is actually going to be getting built at Jesse Brown that's available for the future. Currently, those screenings, the mammography screenings, are being done through community care. The women's health program has a mammography coordinator. That's Lisa. She's the one who works very closely with all the PAC teams and community care partners and radiology and vendors to coordinate all those services. But eventually, rather than doing community care screenings, it will actually be able to be done at the Jesse Brown facility. So that's something to look forward to.
We also are in the process of building out a new clinic. This has been a long time coming. Right now, the current facility space does not adequately accommodate the amount of women veterans receiving care and the amount of staff that the program has grown into. So we will have a new clinic. We're very, very excited about it. It'll be located on the second floor above the current primary care clinics. And it'll be a very large suite with group space and conference room space and PACT space. Angela was mentioning PACT. PACT stands for Primary Patient Aligned Care Teams. And we've got women's health specific PACT teams. Again, this is something that is a mandate for every facility in the country to have. One of the things that I also want to mention is, while not co-located within our clinic, due to the knowledge that women are more likely to experience intimate partner violence and military sexual trauma, the Women's Health Program and team works very closely with our MST coordinator, that's Alan Kowski, and our IPV coordinators, which is our intimate partner violence coordinators. We have several. That team has grown significantly in Chicago, and we work closely with them to coordinate care and for women veterans to be connected to them. We realize that issues like harassment, issues like MST serve a significant barrier to women and in getting care, and we want to make sure that they're linked and connected, and that does not serve whatever hindrances we can help take away, we try to do.
And just while Asya was kind of introducing other coordinators, I do want to put out there, like I did mention Lisa, she's our mammography coordinator. We also have Prasitha. She's actually our maternity coordinator. There are a lot of veterans that don't know that the VA covers certain things for maternity care. That includes physical exams, lab testing, the prenatal education and screenings, ultrasounds, labor delivery. They also cover the newborn care from the date of birth plus 7 consecutive days after birth. And that's our coordinator actually has perinatal classes and postpartum classes. So I do want to put that out there. And then we also have a PAP/Service Act coordinator. That's Irene. She works very closely as well with the PAC teams to make sure that all those screenings for cervical cancer are being scheduled, and same for Service Act and reaching out to veterans and making sure, kind of seeing if there's any toxic exposure that has occurred and if they need that screening to be actually completed by a provider. So those are some more coordinators that we do have within the Women's Health Program.
Mm-hmm. I see a question was put in the chat here, and the question was, are there any plans to move the women's clinic out of the central facility so that we don't have to be exposed to the harassment while coming into our appointments? I know you mentioned telehealth, but many appointments require face-to-face. That's a really good question. We appreciate you asking that question. It has been a conversation in the past whether or not the women's health clinic would be outside of the facility or not. The final decision was made that it would remain within the facility. So right now that is not in the works. But when cases of harassment happen, we do want to know about them. Like I mentioned, we work hard to make our facility more welcoming. In the past, the Women Veterans Program Manager held a very strong campaign with signage within the hospital that says, "Hey, my name is not Hey Baby." And we had pins for people to wear. We are trying to do additional things in certain more heavily populated areas that have signage on women veterans to help curb harassment. We do not tolerate harassment. It is not okay. We want to know when it happens. There are methods to file when harassment does take place, whether it's with police, whether it's filing a disruptive behavior report. And we do get notifications of these, or talking to a patient advocate, we do get notifications of these occurrences, and we do want to do our part to follow up. The other thing that I'll say, harassment or not, we want all women veterans to know that there is a National Women Veteran Call Center available, again, whether a woman veteran is connected to care or not. The representatives are 24/7, and they're on the line to connect women to local facilities to help them connect to care. The number is 866 VA Women. And again, that is available to all women veterans, connected or not, regardless of discharge status, regardless of which facility they go to be able to be connected to care. One of the things that I also want to mention while we have callers on the line and listeners is that there are certain things that we do, and I was reminded of this with the harassment question, and I appreciate that question. One of the things that the program manager and the program specialist do is every quarter we hold focus groups. And one of the questions we always ask about is harassment. We have a quarterly focus group. We host quarterly focus groups targeting women veterans from different areas. We have surveyed women veterans from those who engage in mental health, those who engage in other services and programs, who are part of, maternity care, who are part of other services within the hospital, like whole health. And so we ask about women veterans' experiences in care as women veterans' experiences in care with harassment, whether it be within the VA, within Jessie Brown, and what we can do to make things better. And then we also have 2 specific women veteran town halls a year. What we try to do is we try to align these with experiences of women veterans that affect them more. So for example, we have had a town hall in the past in the months of October for Breast Cancer Awareness Month and for Domestic Violence Awareness Month. We have had town halls focused on maternal mental health last May, since that's Maternal Mental Health Month. And so we've had a town hall in the past during Sexual Assault Awareness Month in April. So things like that. 2 town halls. We call out all women veterans engaged at Jessie Brown to be able to ask leaders questions and get information on the services that we receive.
Asya, did you see there's a question in the chat? It says, is there any military women's health education being done with other departments, i.e. ER, VAPD, radiology, and etc., to improve the sensitivity to women's specific health needs and EBP in women's health? Any support to these departments to ensure they have the most updated and appropriate equipment and supply?
That's a great question. Thank you for reading that and sharing that question with us. Yes, there's absolutely things being done. There have been trainings specifically in our inpatient psych unit. We had a policy developed on addressing harassment that can take place while women veterans are on the inpatient psych unit. I can say in the emergency department, yes, we certainly have spoken to them, work with them. They're actually in the middle of a contract to obtain a SANE nurse, that's a sexual assault nurse examiner, to be able to help women veterans. All of these section chiefs have contact with our women's health medical director to be able to collaborate and consult when women veterans present there. Me and our women's health medical director lead the Women Veteran Health Committee with almost all of the, radiology, emergency room, other areas as well, not VAPD, but other areas that interface with women veterans. And we talk about quality and improvement of services to women to make sure that that happens. Angela, do you also want to talk about the CBOC visits?
Yeah, so every quarter we are actually the Women's Health Administrative Staff. So that is the Women's Health Medical Director, which is Dr. Deshpande. And then we also have Asya and myself that are going out to each CBOC. And what we're doing is meeting with each CBOC team of women's health to find out exactly what is needed at each of those facilities, make sure that all their needs are being met, that they have the available resources, the appropriate things, just like almost like this question, to make sure that everything is covered and protected and education is available at these locations as well, not just at Jessie Brown Women's Health, the Women's Health Clinic. So that is something that we are doing. We're also making sure that their templates of patient flow are actually accurate and not being overbooked, and making sure that there is availability. We're making sure that all supplies and equipment is up to date and also available at those facilities. We do not want anyone going to those facilities and being turned away. So we are making sure we're each CBOC, we're meeting with them. We have monthly meetings, and then even quarterly, we're going to the actual facility on site to be able to view and make sure everything is actually there. And we're working with the CBOC managers as well to make sure everything's been in line and working. And one thing, Asya, and I know we didn't mention when we were talking about services, because it's more new and more stuff is coming. And I don't know if you want to get in more depth of it or not. But what I wanted to mention was about the reproductive health expansion with the IVF and abortion services. Did you want to go into more detail that how we're going to be offering certain things for the clinic, for our veterans?
Sure. So we'll start with IVF. So we recently heard on a national call that the VA will be expanding IVF services and who's able to receive them. Right now, IVF criteria are incredibly stringent, and it has been limited to individuals who are infertile due to a service-connected disability, who are in a heterosexual relationship, and who are married. So going forward, that will be expanded so that single individuals and individuals in same-sex partnerships are also able to get services. The VA is not yet in a position to be able to implement those services, but it's coming down the pike. And so that will be coming down. Now, something also that Angela mentioned is reproductive expansion. Reproductive expansion is something that the VA had to take on after the overturn of Roe v. Wade. So something that every VA is mandated to do is to provide coverage for terminations, non-elective terminations for veterans who meet criteria. Those criteria are when the life or health of the pregnant veteran is in danger. This also includes CHAMP VA patients, so non-veterans who are married to 100% service-connected veterans, and we do serve those at Jessie Brown. And individuals who experience rape or incest. The determination is made between a veteran and their healthcare provider. And that is something that, again, every facility is mandated to do. This is coming down from Congress, from the national offices. And at Jessie Brown, we are proud to be working on the implementation of the service and being able to offer medication abortions at this time, with a plan to be able to move forward with surgical services as well. Again, this is non-elective, so only individuals who meet criteria will be eligible to get that care.
Thank you. And we do have a question in the chat. It says, maybe you spoke on this, but do you have coordinators available to help with the homelessness? And does case management handle that portion of your women veteran services, or is it a coordinator specific?
That's a great question. Thank you for asking it. So we do have a full-time social worker assigned to the Women's Health Clinic who is able to help coordinate this care, and also connect to homeless services available within Jessie Brown. So there is a walk-in clinic within Jessie Brown on the 8th floor of the Damon building that is able to see men and women. And then there's also the National Homeless Hotline that, just like the National Women Veteran Hotline, individuals can call and be connected to receive care. That's a great question.
Perfect. Thank you. And then we have another one. She said, that's really good. What amount of women veterans are out there, and what % are engaged in services? What is the goal to increase the reach of these women?
That's a great question. I do not have statistics pulled up in front of me. What I can tell you, the statistic that I am looking at that I had, is when it comes to veterans enrolled in care, there's almost 5,000 women veterans enrolled in care at the Jessie Brown healthcare system. But Cammie, that's a great question, and we are able to find that information and make it available. It is not hidden information. We do a lot of outreach. We're very proud of going out into the community and providing services for women, providing outreach to women veterans on the services that we have available. The goal, absolutely, to increase reach, going out to areas where we know women veterans reside and are not connected. We recently learned that Chicago has the highest number of women veterans in the entire nation who are not connected to VA services, whether it be VA, VHA, VBA, or national cemeteries. And we are going out to, again, targeting specific areas to be able to do that. I can tell you, Angela was just recently at a women's health conference in Indiana. We know Indiana has a very high amount of not connected women veterans, and we've got other outreach events that we've gone to that Angela will also mention some of the upcoming events that we'll be going to reach women veterans.
Yeah, so I could share that now just to let you guys all aware. Let me see here. So yeah, so the events that the Women's Health that are doing in order with the outreach to increase women veterans. So actually this month coming up on the March 30th, we have a Women Veterans Town Hall Resource and Employment Fair that's actually happening at Malcolm X College. And then on April 10th, there is a National Minority Health Month Fair that's actually being held at Jessie Brown. And on April 18th, we have a Bellwood Veterans Fair that will be happening in Bellwood, Illinois. In June, on the 12th, we have Acknowledge Women Veteran Recognition Day. We're going to be hitting 76 years for acknowledging women veterans. So we're going to be actually doing a celebration in honor of that. And then in June, on the date, it's not confirmed, but there will be a health convention fair at the out in Crown Point, Indiana, because that was one of the things, like Asya was saying, was we come to find out that there are a lot of women veteran. The numbers are very high that are not registered. So we want to target out that way more so. So we'll be doing a fair out there. July 16th, we will be having a Jessie Brown Women Veteran Town Hall that is virtual. You're going to start seeing that being advertised in a few months. And then we come in the fall, we have in September 18th, we have a National Association of Black Military Women that will be happening in September. We also have the Jesse Brown's baby shower that we'll be hosting on the 20th of September. And then we have a date that's not determined yet, but we're actually in the process of starting to plan. And I'm saving the best for last. We are actually going to be hosting another Jesse Brown Women's Health Stand Down and Mini Retreat. So we are forming that committee and starting that planning process, but it's going to be sometime in the fall as well. But there is no date yet for that. So these are, just kind of what's coming up. Even though these are already scheduled, there's a lot of things that are planned and we kind of figure out a month ahead. So there is going to definitely be more that is going to be occurring, and then ones that we actually still want to plan and kind of go on with what we're promoting for that month.
I'll also add, like I said, we try to pair events with nationally known awareness days, and we've done a really wonderful job. We're proud to try and have at least one event per month, whether it's internal or external, where women's health is represented. Ever since January, January was cervical cancer awareness. We had a booth for cervical cancer awareness month. February is heart month. End of February is also National Eating Disorder Week. We had information available on all of those occurrences and sort of acknowledging what we have available. We always have little goodies that women veterans can receive during our at the info desks and get information, meet the program coordinators who facilitate those programs and those services. And then March is, I don't even know how we forgot to mention it, but is Women's History Month. And so last Friday, we had a really wonderful and very successful event in partnership with the Chicago Vet Center called Fabulous in Fatigues. We had about 30 women come in person to the Chicago Vet Center, which is located on the south side of the city. And we had food and we had trivia, and women learned about the services we had available. We shared some wonderful laughs, cake, coffee, goodies, gifts, and information on specific women veteran services, being able to meet with vendors, being able to obtain information on groups that we have existing for women veterans, etc.
Yes. And one thing,
Asya,
yes.
Can we mention, excuse me, our 4th annual
Of
women's
course.
conference this Saturday
Of
at
course.
the Chicago Vet Center, same place. Just had to throw that out there right quick.
Please. Angela, you were going to say something?
What I was going to just mention, because you were talking about what we were doing every month and things like that. And I did want to put out there that every quarter I create a newsletter that actually gets sent out to the, within our employees at the VA, our community partners. And just recently in December was the first issue that actually got sent to our women veterans through GovDelivery. So that is something that shows everything that women's health is working on. Things from what the clinic is doing, what's going on with our providers, what outreach events were being done, what changes are happening, staff spotlights, things like that, of who got awards granted to them and everything. It's very exciting. I've gotten a lot of feedback. I also promote other services, things like whole health. All the women veteran group classes that are being offered are perinatal classes, and who to contact. But there's a schedule even for the wellness center of what times at 1 o'clock every day to be able to go to the wellness center and work out for just women only. We're going to be having just completed issue 4, right, Asya? Yes, issue 4. I just completed it, kind of just going to go over, proofread it, and that's going to be actually going out at the end of March. And then that is something that we try kind of always updating. Another thing is all of our upcoming classes, or not classes, groups that are happening. For an example, just like Cassandra said, the event that's actually happening this Saturday at the Vet Center, we are advertising that in clinic. Those are even going in our welcome folders. So when we have veterans that are new to the women's health program, we're providing a folder of all resources and even providing group calendar schedules, all the events that are happening, even the ones with community partners that are occurring. Doesn't have to even just be at Jesse Brown, but we want our women veterans to feel comfortable and to have that community and grow and be able to have that relationship with other women veterans.
Absolutely. A question is being asked in the chat. It's sent directly to me, but I wasn't sure if it needed to be shared out loud. I feel invited to share it out loud. The question is coming on April is Sexual Assault Awareness Month and Whole Health Month. And the question is, could we partner on doing an event or a table? Absolutely, we can. We would love to partner. We appreciate partnerships. We are more than happy to partner with Whole Health. During our Women Veterans Stand Down and Mini Retreat, hi, Laura, we had Whole Health there. We partnered with Whole Health. We continue to do that. Whole Health, M2VA, who has sort of recently transitioning women veterans. Let me see, social work services, MST coordinator, IPV coordinator. These are sort of very strong partnerships that we have because we know that women veterans interface with all of these services, and we want to make sure that they're well connected. God bless the ministry. Hope to see you all at future events. Good day. Thank you, Cami, for joining us. Any other questions that, Cassandra, if you want to ask us, or, we could keep talking. But if there's specific questions that people have, we're happy to answer them.
I'm looking on my Facebook page and there are no questions there.
Sure.
And I was trying to think of some things to ask as it relates to the different programs there. And then we have Jesse Brown, we have Hines, we have the place I always go, Captain Leah Lovell. I'm trying to give the whole name as opposed to just saying Lovell. Okay, so and this is being recorded and will be uploaded onto our YouTube channel. So for the women that do not live in the Chicagoland area and say they're visiting and something unfortunate may happen and they want to come to Jesse Brown, what is your address and what floor can they go to on for the women's health?
Sure, that's a great question. So our address is 820 South Damon. We're located in the Illinois Medical District on the near west side of the city. We are a safety net VA. We have more women veterans, like I said, than any one of the other 8 facilities within our region. Women veterans can connect to us, the Women's Health Program, and we can assist in registering them. And if they're not registered, we can direct them to register. You can register and enroll online. You can register and enroll in person, or you can do it, like I said, on site, or you can do it by mail. So there's multiple ways to be able to get connected to care. We truly, truly want women veterans to know that we have care specific to them. When we were at the event on Friday, women were surprised. These women are middle-aged, and they are shocked at the services that are now available that were never, ever formerly available before, specific to women. And so we welcome our women veterans to get care. And if someone is connected at a different site or wants to be connected to a different site, we can help link them. We have some veterans who seek care across different Chicagoland sites, whether they used to get care at Lovell or North Chicago and want to come now to Jesse Brown, or have certain care that they get at Hines and they get other care at Jesse Brown. That does happen. Certain services are just not available at other facilities. For example, like urogynecology, or even having full-time gynecology is something that's not available at every VA. So we're very, very proud of the fact that we have that as a service to offer. One other thing,
I'm sorry. One other thing, if you all were not there last Friday, you missed a wonderful time. But what I would love for you to do, because there were some things that you all said during the spin the wheel, the questions that I had no idea, like how many CBOCs are in the area, just the plethora of questions you asked. So would you mind just throwing some of that information out? Because like I said, we are Facebook Live. So if you can throw some of that information out there for us, and for those that didn't attend, that were unable to attend.
Yes, I could do that. Let me just pull up the questions I created here.
So
So we,
while, oh,
oh, go ahead. No,
I
go
was
ahead.
going to give you time.
No, go ahead. You could
I
talk.
was
I'm
going
gonna
to
pull it
say,
up.
while Angela's pulling it up, I do want to say, we as the Jesse Brown, at the Women's Health Clinic, we stand out in the fact that all of our providers are female. We do not have a male provider, from our MSAs to our pharmacists to our PAC nurses, doctors. We do not have male providers within our clinic. Males sometimes accommodate women to appointments, but we very much watch this. We want to restrict access to male identified individuals so that women feel safe. We prioritize and understand that safety is incredibly important, not to be understated. And we want to create that kind of a space for our ladies. We do serve CHAMP, like I said, not only veterans, but the Chicago facility does serve CHAMP VA patients. So if someone is married to a 100% service connected veteran, they are able to get care within Jesse Brown as well. Go ahead, Angela.
All right. I do have it pulled up. So I just want to let everyone know. So during that event on Friday, what we did for trivia was we did a spinning wheel. We categorized each little section. So we had vet center, and then we had women's health facility at Jesse Brown. We had Women's Month, History Month. We had cervical cancer, reproductive health, suicide prevention, breast cancer. Then we even had where then it was other things, as in name the titles of certain people that are within the women's health. So what, just like Cassandra was saying, it was a blast. Everyone got very much involved, to the point where there was laughing, screaming, excitement. I mean, it was jokes being put out there, but questions that were asked. So for an example, we're going to start with like Women's History Month, because that's the month that we're in. One of the questions was, in which year did the women begin servicing in the U.S. Army? There was a good amount of people that were very close, but ended up being 1775. Although they weren't officially enlisted at first, but women have served in the U.S. Army since 1775. One of the other questions was, in which year did the first African-American woman enlist in the U.S. Army? And it was actually 1866. And everyone was blown away at that year. And doing so, it was because the person who it was in 1866, Cathway Williams, was the first African-American woman to enlist in the Army, doing so, though, under William Cathay. So she was assigned to the 38th U.S. Infantry, and despite being hospitalized for illnesses several times, she managed to hide her own gender for 2 years before post-surgery. Then she was discovered that she was a woman. That ended up leading her to discharge. So we were asking questions, but even giving the background of it, not just saying 1866. One of the other questions on the facility of women's health was, who had the largest women's health clinic in the VISN 12? And that includes Jesse Brown, Hines, Lovell, Milwaukee, Iron Mountain, Danville, Tomaha, and Madison. And everyone was surprised by this answer, but it's actually Jesse Brown has the largest women's health clinic within the VISN 12. There's different model type, like different types of clinics with the hospital, with the HCS, and I'm forgetting what that acronym
Healthcare
is.
system.
Healthcare, thank you, system, where there's 1 through 3 different models, which Jesse Brown Women's Health, we're model 3, meaning that we have our own clinic separate from other facilities, like just like on the main floor of the atrium, where you have blue clinic, green clinic, things like that. We're model 3, where there's a designated space on a whole different floor.
Let me just real quick. Thanks, Angela. Just real quick, I will add, so all of our CBOCs besides ABJ, which is in Crown Point, Indiana, are model 1, meaning men and women are seen in the same area. And ABJ is the only CBOC that's a model 2 clinic. So women and men are seen in the same area, but women do have an individual separate waiting room in Crown Point, Indiana. And we have visited all of the spaces. Really impressive women's clinic and the services that they have available in Indiana.
Yes. And then it came down to like maternity care. There was a bunch of questions asking what is the condition that affects your ovaries by imbalances of reproductive hormones, PCOS. We even put, is it true or false? Does Jesse Brown cover newborn care on the date of birth from 7 consecutive days after birth. That's true. Does Jessie Brown have a private mobile suite for lactating nursing mothers? A lot of people said false, but it's actually true. Women's Health Program does have an actual mobile suite. It's called Mama Vad Pod, and it's located on the first floor in the bed tower. A lot of people then afterwards said, oh, I've seen it. Didn't know what it was, but it is. It is a mobile suite for lactating nursing mothers. Then it went to suicide prevention, asking who knows the new crisis line, when's prevention week, what are the increases, risk of suicide in women veterans, to what are the ages of being, that you have to start getting screened for breast cancer. And then it came down to, just like she was saying, the vet centers, how many vet centers are in the facility, things like that. And those vet center questions did come from actual Chicago Vet Center, not from us specifically. But it was definitely something that was very interactive. And a lot of the women veterans, we did a survey after and said that they prefer that and learning what services are available than getting a sheet of paper. They were able to learn more from just that and being interactive, listening and engaging than just getting a piece of document handed to them. So it was an amazing event though. Thank you, Cassandra, for acknowledging that.
I'm reminded of a couple more things that as Angela was talking. So when it comes to maternity care, yes, we've got a lactation pod, and Angela also mentioned some of the services that are covered in the consult, the maternity consult. So we're really proud of that. One of the things that we also established in 2022, so in the pandemic, are our perinatal classes. So we have classes available that bring together whole health, nutrition, sexual health, mental health, to address concerns for women who are perinatal or postpartum. So this is all virtual and something that we have available. It rotates. There's about, I think I want to say about 12 sessions each time. We started with just a perinatal class with these informative sessions, and now also have since started a postpartum class. So all of that is available to expecting women veterans virtually by being connected to our maternity coordinator.
And I do want to just mention there, it goes through like 8-week sessions. That is how Prasita, our maternity coordinator, does it. So we actually start back up with the perinatal women classes beginning Tuesday, March 26th, and then that goes down to May 14th. And then it would switch back over to postpartum. She does alternate.
And the other thing I will also mention is when lactating women veterans are in crisis and find themselves admitted on the inpatient psychiatry unit or on an inpatient medical unit, one of the things that we have purchased is a pump for women veterans to be able to, we wrote a policy and purchased a pump, a hospital grade pump for women veterans to be able to meet their lactating needs when they're on the inpatient unit, so that they don't develop mastitis, so that they don't feel unable to provide for their little babies. So, we do want to brag. We think we provide really good care. We are really proud of the care that we provide. We recognize that women veterans feel most supported by being acknowledged. We see our women, we hear our women. We work really hard to make services better. We want women to feel support, to build connections, reach out to others, whether it's being in peer groups, whether it's being in mental health groups, social work groups, getting services, whole health, coming into the facility, chatting with us, sharing concerns. We want women to know that they are heard, that there are resources available to them, that they are not forgotten, and that we are, we're here.
And I do want to mention too, because I know Cassandra wanted you, Asya, to kind of share where the location was, but I do want to put out there, if any of the women veterans that need to get a hold of myself, program specialist Angela, or Asya, program manager, you could call our office. The number is 312-569-8387, extension 59339. Once again, the number is 569-8387. That's the Jesse Brown main number. And then extension is 59339. And then the Women's Health Clinic number is the 312-569-6246. Or you could call 312-569-6168. And then you could also schedule appointments, and there is the Women's Health Services through the Jesse Brown Department of Veteran Affairs website. There is actually where you could get resources, register your care, schedule your appointment, and get handout, things like that.
Thank you so much.
You're welcome.
Asya, do you have anything else you want to say before we end this session?
Sure. Just a couple of things, again, all aligned with what Angela was saying, and I'm so glad she's bringing these things up. So, two things. One, for the first of all, I think I said 866 before. That was incorrect. It's 855 VA Women. So the National Women Veteran Call Center is 855 VA Women. That's 855-829-6636. So I want women veterans to have that number. If you forget anything else, remember that number and we can connect you to get support. 855 VA Women. And then last but not least, I do want to share that we have information on so the numbers that Angela mentioned to the clinic, to the care that's provided, and to women veteran healthcare, to any woman veteran. She does not have to be connected to Jesse Brown. Public facing at www.va.gov/chicago-health-care/health-services. I know it's long, /women-veteran-care. But if you forget all that and you're on Google, you type in Women's Healthcare Jesse Brown VA, our website does come up and you can find our contact information and the services that we provide.
Asya, are you able to share that link in the chat? Is your chat open so that they could just copy it?
Absolutely.
And I could do, yes.
Also, let me, I would love to put it out on Facebook. Yes, Stephanie, it will be made for viewing. What I'm doing, I am recording our session, and then I will upload it to Top Flight's YouTube channel, but I will also copy and share a link with Asya and Angela, and that way they can share it out to everyone. So yes. And if you go to our YouTube channel, you'll see all of the other stuff that we have done and taking into account women's health in itself, because we partner with the Rush University Medical Center, both VA hospitals. We had them to come in, and I am happy to say that Jesse Brown will be doing the segment for cervical care in January next year. We have a list of monthly awarenesses that we are looking for people to come on and talk if that's your area of expertise. But if there's nothing else, I am going to end this session.
Let me just say, Cassandra, we're so thrilled to have met you and partnered with you. We really appreciate the work that you do for women veterans and, being able to promote the services that we offer. I see a comment in the chat. Laura also said you're doing amazing things and moving this facility and this program forward by leaps and bounds. Thank you so much for the work you've done and continue to do. So we appreciate that. We care. We really do care to do a good job on behalf of our women veterans.
Yay! And if you don't mind, by going to our website, www.topflightdefenseinc.org, if you sign up for our newsletter monthly, and it's free, you'll get to see all of the things that we're doing every single month, the classes that we're having and the events that we are either hosting or attending. And we're on Facebook, Twitter, and Instagram, and we have our YouTube channel. So join us, keep us going, because the more people we get that's pushing us, the more we can put out there and take care of our female veterans and the women that are in their community, because it takes a community in order for us to build, because we are that vessel. into the world. So let me end this on Facebook, if you all will hold on. Thank you everyone for Facebook for tuning in. I love you. I need you. Continue to follow Top Flight Defense Incorporated.
Thank you so much.
All right. And now I am going to end our recording saying thank you, everyone.